Jy weet Hendrie, julle man sê altyd dat julle vrouens glad nie verstaan nie. En ek moet eerlik met jou wees, ek verstaan julle koppe glad nie.
Ons kan ook nou nie meer verder sê dat dit is omdat mans van Mars af is en vrouens van Venus nie. Daai werk nie. So om te probeer uitvind wat die verskille tussen mans en vrouens is, het ons nou besluit om 'n nuwe konsep te begin van kroontjie tot toontjie. En dit is presies wat ons gaan doen om te kyk wat die verskille tussen 'n man en 'n vrou is, of ons dit gaan regkry. Ek weet nie.
En ons begin met 'n baie interessante onderwerp, ook baie ernstig haarverlies vir mans en vrouens. En ons het gister gesels met Dr. Larry Gersowitz oor hierdie kwessie en om uit te vind wat die oorsaak daarvan is.
Right, so there are hundreds of different causes of hair loss, and it's very important to understand what the cause of the hair loss is before obviously one can treat it properly. By far the most common cause is genetic hair loss. And genetic hair loss affects as much as 80% of men and anywhere from about 8 to 12% of the female population. Then we get lots of other forms of hair loss, and one has to distinguish between what is a permanent hair loss, or what's going to result in permanent hair loss, and what's going to result in a temporary hair loss. And there are lots of causes of temporary hair loss. And I always explain to patients that when they sort of see lots of long hair falling out and just shedding, never to panic, because when you see a long hair falling out, very often that's a temporary cause. You've heard the expression, somebody got such a fright, all the hair fell out. Literally, that can happen. So stress does play an important factor as well. But anything that causes the body stress can affect the hair. And because the hair is one of the most actively dividing cells in the body, anything that occurs in the body can affect that hair. So, for example, after a operation, a couple of weeks later, one may see this shedding of hair. We call that a telogen effluvium. But other things like high fever, any type of disease that affects the body can affect the hair. And then one has to look at, obviously, things like medications. There are lots of medications that can cause hair loss. Then obviously various conditions of the body, like hormonal conditions, thyroid, overactive or underactive thyroid, anemias where not enough oxygen is getting into the blood can affect the hair. Chronic diseases like diabetes will also affect the hair. But as I said right at the very beginning, by far the most important thing is genetic. And then the last thing, very important.
Wel, jy sukkel duidelik nie met haar verlies nie, Elsa. Dit klink altyd so mooi, elke oggend.
Wel, baie dankie. Ek kan nou nie dieselfde van Jorney sê nie, maar ons gaan nou nie ons verder veel daaroor uitlaat nie. Ons het nou gehoor wat die oorsaak van haar verlies is, maar ek dink ons moet uitvind hoe om dit te voorkom.
Because genetic hair loss affects as much as 80% of men and 10-12% of females, we do start noticing it very early. And just to explain, because I didn't explain what it is, genetic hair loss, everybody's got a hormone, and males have got obviously male hormone, but we also have female hormone, and exactly the same with females. With men, we lose hair in a typical horseshoe shape on the top of the head. The sides and the back is always spared. And when the scientists looked at all the hair, it's important to understand that all the hair on our head is dead. It's just dead protein. The little follicle, which is the factory that makes the hair, sits as much as 0.5 centimeter inside the skin. And this divides, deposits cells on the outside, and the hair elongates, gets longer and longer and longer. Now, in a genetically predisposed individual, somebody's inherited this either from the mother or the father, there's a tiny little thing sitting minuscule on the wall of the follicle called a receptor. And the receptor is like a little lock. Already from the age of 11, 12, 13, 80% of young boys, and as I said, 10, 12% of young girls, the hair starts thinning. What happens at this age? Male hormone kicks in. And that male hormone, testosterone, or more specifically dihydrotestosterone, and that DHT circulates in the bloodstream. And it's almost like a little key that fits specifically into that lock on the hair follicle. And it causes the hair not just to fall out, but it becomes thinner, finer, lighter, shorter, and eventually the hair disappears. The hair on the sides and the back of the head develop embryonically in the baby from a different area. So that hair never, in men, never has that little receptor, never has those little locks. And that is why even a 100-year-old man, there's a lot of hair on the back and the sides. So that hair is not predisposed to fall out. Once the hormone attacks the hair, it shrinks. It becomes miniaturized, thinner, finer, lighter, shorter and shorter and shorter, and eventually it disappears. And once that hair has disappeared, it is gone.
En so gesels Dr. Larry dan oor haarverlies.